Hi, this is Dr. Sage Wheeler with Sage Med in Bellevue, Washington. Today we're going to be talking about our program that's called Allergy Easy. This is a testing and treatment protocol that we use to desensitize people to their allergies. This is not an allergy treatment that just suppresses symptoms. This is something that identifies your allergies and gives us tools to treat them so you no longer have these allergies. Sublingual immunotherapy works by giving your body low daily doses of the very allergens that you are allergic to. We identify these by doing a skin prick test. We test for 60 common allergens that are typically region specific. So here in the Northwest, we're looking at a lot of trees, grasses, mold, dust, dander, and even insects like cockroach, which leave behind tiny particles that can cause allergies. So these 60-point allergy tests are fairly quick and easy. It takes about 15 minutes after about a 5-minute intake. And instead of the old-fashioned way of using needles to dip in the allergen and poke your skin, we have OmniPoint applicators which apply 10 allergens at a time. And you can see this when we do the demonstration. So today we have a patient with us who's volunteered to be a part of the video and let you see the testing process and what that all entails. So now we're going to do the skin testing to see to what allergens our patient is reacting. So this is our 60-point test kit. First I'm going to get some alcohol, and you'll just feel a cold sensation as we disinfect the skin and let it dry. This takes up quite a bit of space, which is why we do it on the back instead of on the arms, which you sometimes see done, which is for testing a lower amount of allergens, maybe 10 or 20. We prefer to do more allergens to give us a higher chance of identifying what actually is causing your symptoms. These OmniPoint applicators are not quite as sharp as a needle. It's sharpened plastic points, so there can be a little bit of discomfort during the treatment, but it's pretty quick and only moderately uncomfortable. All right, so we're going to go ahead and give you a little poke. Are you ready?
Ready.
Okay, here's the first one. Good, so you didn't even flinch. Got a tough one here. And that's all there is to it. Process that used to take about 20 minutes takes less than 20 seconds. We use these applicators that we have covered the tips in the allergens, and they have small little fine points on them that slightly puncture the skin just enough to trigger a reaction. So now all we have to do is wait for 15 minutes, and we'll record the size of the reaction with a ruler. And based on that testing, we will mix up a sublingual serum that the patient can drop under her tongue with daily increasing doses until she becomes desensitized to her allergies. So we'll check back in 15 minutes and see what the results are. Okay, we're back to read the reactions. It's been 15 minutes since we applied the allergens, and we're going to wipe off the allergens with an alcohol wipe. And you can see there's a lot of redness, but redness doesn't necessarily mean allergies. How we can tell if there's a true allergy is by the presence of the white spot. So this top point right here is actually our control point. You can see if I blanch it a little bit, it turns white. And that's how we tell if something is positive or negative. The negative controls over here, you can see that there's minimal blanching. And so as we look at the skin, we see there's a positive reaction. There's some minor positives here. All these trees down here, these are positive. Grasses are up here in this quadrant. Got a couple positive reactions there. And so, we won't bore you with the details, but we basically just get this Allergy Easy reaction marker here, in this ruler, and we write down the size of the reaction for every spot. And then the patient has a record of what exactly it is they are reacting to here in the local environment, and then we can order the serum that contains those allergens, and the patient can begin the desensitization process. Okay, so that's all there is to it. We just finished up measuring all the reactions. We got that recorded for the patient. We're going to send our request to a compounding pharmacy that specializes in allergy treatments. The specific method is called sublingual immunotherapy. And we're going to prescribe some drops for this patient, and over the course of the next 90 days, she'll get increasing daily doses. And according to the research on sublingual immunotherapy, there's an approximately 80% positive response rate, meaning by the end of the 90 days, 80% of the people who have done the treatment report significant improvement or elimination of their allergy symptoms. And from that point on, most people no longer need to take allergy medicines or nasal sprays or eye drops, and we were able to achieve all this without having to do allergy shots, which is another form of immunotherapy, but it's much more inconvenient and of course more painful. So we hope you've enjoyed learning about our Allergy Easy program. Allergy season is coming up fast, and the earlier you start your desensitization, the better. If you are interested, you can call us at 425-679-6056, or you can check out our website, www.sagemed.co.